Good day, I'm Julie Bennett, and I will be your trainer for this session. I've been working in the healthcare field for over 36 years and have certifications in health information management and in privacy, security, compliance. We're going to spend about 30 minutes for this training. You'll have an opportunity at the end to ask questions, and you'll be given a quiz by your instructor to see what you've learned. As you begin your healthcare career journey, this training will assist you in understanding the basis for healthcare regulations and the Health Insurance Portability and Accountability Act. Our goals for today's training: commit to being and doing good, be able to put yourself in place of the patient, understand basic regulatory oversight in healthcare, understand what the Health Insurance Portability and Accountability Act, or HIPAA, is and why it's so important. Learn common best practices to keep patient health information private and safe. You'll have an opportunity to ask questions, and then you'll take a quiz. Make a commitment to good patient care. Do the right thing. Make good choices and have good boundaries. Remember, you will never go wrong in asking questions. And always put yourself in the shoes of the patient and or their family member. Think about how you would like to be spoken to, spoken about, and treated. This pictograph shows just some of the regulatory bodies that healthcare entities, insurance companies, and providers must keep track of to be compliant. For example, HHS, U.S. Department of Health and Human Services, is charged with enhancing the health and well-being of all Americans. CMS, or the Center for Medicare Services, takes care of Medicare Part A, hospital insurance, Part B, medical insurance, and Part D, a prescription drug benefit. Senior citizens and those with disabilities use Medicare. CMS is also responsible for administrating Medicaid insurance and CHIP, the Children's Health Insurance Program. The OCR, or Office for Civil Rights, is responsible for HIPAA. They enforce laws that protect the rights of individuals and entities. The OIG, Office of Inspector General, promotes accountability, integrity, and efficiency at both the federal and state levels. DOJ, the Department of Justice, enforces the law and works to prevent and control crime. The federal AG is under this department. CLIA, the Clinical Laboratory Improvement Amendment. These are regulations for laboratory testing and ensure that labs must be certified in order for them to bill Medicare and Medicaid. TJC, the Joint Commission, and DNV, Det Norsk Veritas, are both examples of organizations that review facilities and accredit them. And keep in mind, there are also state laws and other accrediting organizations that regulate healthcare. And whatever facility you end up working at or volunteering or are a student at is at the center of all these regulatory bodies. And now on to HIPAA. The Health Insurance Portability and Accountability Act was signed into law in August of 1996. It has two titles. Title I protects insurance company in between a change of or loss of job. It's called COBRA insurance. Title II contains administrative standards. One standard is for electronic data transmission, so everyone bills healthcare claims in the same way. Another standard addresses fraud and abuse so that the government is able to save money that's wasted each year by submission of false claims. Also contains the privacy and security rules. The privacy rule defined protected health information and how health information should be disclosed and when authorization is required. The security rule addresses three areas of safeguards: administrative, physical, and technical. The privacy rule went into effect on April 14th, 2003, and the security rule went into effect on April 21st, 2005. The enforcement rule in March of 2006 gave Health and Human Services the power to investigate complaints against covered entities for failing to comply with the privacy rule. That only took 10 years. The Office for Civil Rights was given the power to pursue civil legal action for breaches of health information. HITECH, which is the Health Information Technology for Economic and Clinical Health Act, in 2009 gave incentives for healthcare entities to move to electronic medical records and extended HIPAA legislation to third-party vendors and business associates. There was an amendment in 2013 called the Omnibus Rule, and that filled in gaps in the HIPAA legislation and the HITECH legislation, which were unforeseen in 1996. On January 5th, 2021, the HIPAA Safe Harbor Bill was signed into law. This amended HITECH to incentivize best practices for cybersecurity to meet HIPAA requirements. There would be, for example, less penalty if an entity is in compliance with those standards. So what's next? Well, a couple of things have been done over the last few years. On 12/10/20, the Office for Civil Rights put out a notice for proposed rulemaking to update HIPAA and further strengthen a patient's right to access their health information, lessen the time frame that release of information requests can be fulfilled from 30 to 15 days, among other things. They also have put out a request for information on 4/4 of this year for feedback in implementing recognized security practices under HITECH. And this points back to the Safe Harbor Law and how that affects covered entities and business associates. The HIPAA Privacy Rule. The Health Insurance Portability and Accountability Act, or HIPAA, creates rules and guidelines that all covered entities must follow to keep health information private and secure. A covered entity is any facility that takes care of residents or patients and bills for services electronically. A covered entity is also a health insurer. A business associate is a vendor, a contractor, or could be a healthcare entity that performs services on behalf of a covered entity. That service uses patient information and must be protected as well. Examples would include IT services, ICD-10 or CPT coding services, billing services, or transcription services. Hospitals, physician offices, clinics, nursing homes, dental offices, and health plans are all examples of covered entities that must follow the HIPAA privacy rule. The following slides will assist you in understanding how important your role is in keeping medical information private and secure. And at this time, I want to remind you the acronym HIPAA is HIPAA. It is very commonly misspelled, so always make sure that you spell this correctly. HIPAA privacy, the minimum necessary rule. The minimum necessary rule says that any staff members, students, or volunteers are only permitted to access a patient's record when required to carry out a specific job duty. And the rule states you can only use, request, or disclose the minimum amount of information necessary to do your job, and only when it's required to do your job. Accessing and disclosing protected health information out of curiosity or concern is strictly prohibited. We have to make sure that no matter what our role is in a healthcare entity or provider office, access or disclosure must be for a treatment, a payment, or a healthcare operation activity. Just remember to always have good boundaries and never access information without a job-related need. Never discuss healthcare situations outside of your student work, your volunteer work, or your job. If you're not sure or have questions, please ask your facility leadership or your instructor. Protected Health Information, or PHI. The HIPAA privacy rule requires that we keep information about patients private and secure. Protected health information is any information about a person that can show that they are a patient or someone with insurance. There are 18 specific identifiers that can identify patients. And some of the most common ones are things like patient name, date of birth or age, medical record or account number, fingerprints, pictures, tattoos, address, city, zip code, county or state, phone numbers, or any unique identifier or characteristic to a patient, such as gender. Even when all the identifiers are removed, a diagnosis or treatment may be so specific and rare that a patient may be identifiable. More about protected health information. HIPAA requires that no matter what form patient information is in, verbal, electronic, or paper, we must safeguard it. Examples of electronic information are information contained in an electronic medical record, an imaging system, a laboratory system. Examples of paper PHI would be prescriptions, discharge summaries, office visit summaries, appointment reminders, and receipts. And of course, verbal information is anything that we say. And so we have to be careful and protect information related to patients no matter what form it is. Verifying patient information. Before documenting, administering medication, or any type of care, giving out any information, always pause and verify identifiers to ensure you have the correct patient, resident, relative, or caregiver, you're working in the correct medical record or chart, the correct documents are for the correct patient. Always verify phone numbers, email addresses, and fax numbers prior to calling patients or sending information. Always remember HIPAA's minimum necessary rule. Privacy and security tips. Never access patient or resident records unless you're authorized to do so. Remember minimum necessary and job-related need. Never take photos of residents or their protected health information. This is a violation of the HIPAA privacy rule and Illinois law Title 77. Never use personal devices to transmit protected health information or situations. Examples through text, email, IM, or social media. Never discuss patient or resident information or situations outside of your volunteer work, your student work, or job-related work. Always face monitors away from patients, residents, and visitors. Be aware of your surroundings when discussing patient or resident information. Move to a more private area to avoid visitors overhearing information. Be aware of protected health information, devices, and personal effects left on a desk. Have a place to lock up any documents you are working on. Always check your pockets and bags prior to leaving your site. Never take protected health information out of the facility you work or volunteer or a student at. Always remember to lock your computer session if stepping away from your workstation. Always log off your computer at the end of the day or if you're moving from one computer to another. Never share the login and password for your computer or any other application. Protect your facility from viruses. Never open an email from an unknown sender. or click on unfamiliar links within that email, or open suspicious attachments. Always verify that it is necessary to send patient or resident information in an email. Verify the recipient prior to hitting send. Never communicate patient or resident information via personal email. This slide shows the fines and penalties that any organization or facility may be assessed when HIPAA is violated. The government expects that all employees understand the consequences of violating patient privacy and security. There is no means to sue an employee under HIPAA. However, a patient or their family can sue for damages under state law. Your employer could fire you. You could also lose your certification or license as a clinical employee. And the different fines are based on the levels. Level 1, for example, if the person knew something was a violation, they would not have committed it. To level 4 means that the person knew it was a HIPAA violation, but they went ahead and committed the violation anyway and failed to correct the issue. And level 4 has criminal component to it. So there could be jail time attached to that. So just so you're aware of the consequences from a monetary standpoint. Reporting an incident. It's your responsibility to know the policies and procedures of the healthcare facility or office you volunteer, intern, or work for. Know what to report and how. For example, if there's a clinical incident or a near miss, reporting HIPAA concerns or incidents, or reporting any patient or family member concerns about their care. Any type of concern can be reported to the government at the state or the federal level. This is an opportunity for you to ask questions and have discussions about this presentation with your instructor. Thanks for listening, and congratulations, and have a great school year. This is an opportunity for you to have discussion or submit questions to your instructor. Thanks for listening, and have a great school year. And now it's time for your quiz to see what you've learned. Good luck!